Thank you, Mr. Chairman. Thank you all for being with us this morning. Since the inception of flexible spending arrangements and health savings accounts, millions of Americans each year were using these and other similarly tax-preferred health accounts to help reduce their annual health care spending. However, this consumer access changed with the passage of the Affordable Care Act. Consumers are now required to obtain a prescription for over-the-counter medications in order to be eligible for reimbursement under these accounts. This change, which went into effect January 1st of 2011, severely limits the ability of millions of American families to use funds set aside in their FSAs and HSAs to purchase over-the-counter products such as those for pain management, smoking cessation, and cold and allergy medications. Over-the-counter medications are often the frontline treatment for many common illnesses or for maintenance of chronic diseases and should be treated as medically reimbursable healthcare therapies, just as prescription medications are. A recent study found that over-the-counter medicines saves the U.S. healthcare system $102 billion every year through cost savings associated with over-the-counter medicines and avoided visits to the doctor. Restricting consumers' ability to be reimbursed under FSAs and other tax-preferred accounts imposes an unfair cost increase on individuals and families who are already struggling financially. So that's why I've introduced legislation along with Mr. Kind to restore this benefit called the Restoring Access to Medication Act, and I'm hopeful my colleagues will smile favorably on this legislation soon. According to an April 2014 study by Nielsen, 75% of Americans support changing the law to grant over-the-counter medications tax-preferred preference again. In fact, the Health Choices Coalition, representing physicians, dentists, consumers, retailers, manufacturers, pharmacies, pharmacists, patients, insurers, and employers, large and small, are all in support of restoring this benefit on behalf of millions of Americans. Americans are being asked to fund more of their health care expenses through higher deductibles and copays, so I believe it's more important than ever that cost-effective over-the-counter medicines are treated the same as other eligible medical expenses in tax-preferred health care accounts. I don't know why we should be making it harder for Americans to use their own pre-tax dollars to purchase these everyday health care products. So with that, Mr. Isles, shouldn't Congress be making it easier for people to access these safe and effective over-the-counter medications?
We have been supportive of being able to use HSA, FSA funds towards over-the-counter medications when patients have an option to use something that's over-the-counter, that's a lower cost, potentially not needing to necessarily go and have a physician's office visit. We've been supportive of those kinds of efforts, yes.
Thank you. And on that point, so many Kansas communities face the challenges that come with accessing rural health care. So, Mr. Rathen, do you believe that it makes good public policy sense to require patients, especially rural patients, to seek a doctor's prescription in order to be able to use their tax advantage accounts for medicines that were available over the counter?
Thank you. I believe it makes no good health policy sense to add cost to the system by seeking an additional office visit just to get something that is available over the counter today.
Okay, thank you. I appreciate it. And with that, Mr. Chairman, I yield back.